Technology for better mobility.
So this tells us about the basic what we're going to do. How many millimeters of bone we are going to cut, what are the angles we are trying to achieve.
I am Dr. Suresh George. I'm a consultant orthopedic surgeon with special interest in joint arthroplasty. I qualified from Ireland. I worked in various hospitals in Malaysia, including Kuala Lumpur, Malacca, Seremban. I worked overseas as well, and I've now been in Sunway since the year 2000. Before the onset of robotics, we used to do conventional joint replacement, which has been over more than half a century, and it has continued to improve. We have reached very good levels of expertise and outcomes using conventional methods. But we still had outliers. That means despite everything looked good, patients were still having some dissatisfaction. So analyzing this amount of dissatisfaction, we felt that there was probably some malalignment, some ligament imbalance which needed to be addressed. So what we find is that with robotics, we have managed to address or trying to address and get better alignment, better ligament balancing, and thereby hopefully in the long term give the patient better satisfaction. Let me start with templating first. Those days when we get an x-ray of a patient, we put it on an x-ray box, use a sort of like a template on the x-ray box to actually measure and work out the angles and plan what we are going to do. One of the greatest advantages that I find is the use of a computer and a robot to help me with my planning. So we do the planning before the surgery in the clinic, then during surgery we replan and do final planning intraoperatively, which gives the surgeons a lot of confidence that they're actually doing a very good job. So this has been one of my greatest things. So during surgery, we find that we can get accuracy up to 1 millimeter of gaps, 1 degree of angle, which I do not think that we are able to achieve this during conventional surgeries. Robotic surgery in terms of joint replacement has not been done regularly until maybe the last decade or so. But in the short term, what we find is patients have less pain, they actually bleed less, they're able to mobilize earlier, and when we look at their x-rays, we find that their x-rays look nearly as good as what we planned, as opposed to having surprises when we do the x-rays of the patient after surgery using conventional surgery. That's a good question, because one of the greatest issues that we had actually is to manage joint replacement in a deformed limb. So with the use of computers, robotics, preoperative planning, we are able to align the limb better and balance the limb better, which would have been very difficult to do with conventional surgeries. So in my opinion, doing robotics in a complexly deformed joint has become much more easier using robotics. In my opinion, all patients who have primary joints of the hip and knee arthritis are suitable candidates. We are also beginning to use it in certain types of revisions, surgeries in the hips and knees, but I think that is still in its infancy, and I'm sure it will become mainstream soon. I think the software and the hardware have improved over time. The software has changed in terms of helping us do the surgery. The hardware has become lighter and more easier to use. But I think the greatest positive thing that I can see in the future is use of artificial intelligence incorporating into our robots, whereby the artificial intelligence helps us to make the final decisions on the balancing of the joint, as well as giving us advice during surgery, because I'm sure artificial intelligence will take a big part in our surgeries in the future.